Hello, my name is Tosin Adebayo, and thanks for joining us for another edition of NAFDAC and Your Health, where we highlight how the Food and Drug Regulator is ensuring the availability of quality and safe food, drugs, and other regulated products. On this week's edition of the program, we'll continue our focus on drug abuse and how the agency is regulating drug trade in the country. It should be recalled that in the last episode of the program, we highlighted the destruction exercise of falsified and counterfeit medicines carried out by NAFDAC and other international partners in Benin Republic. The exercise was a culmination of a 5.5-year diligent espionage by NAFDAC, its sister agencies, and other international partners. In this interface with the Director General of NAFDAC, she tells us about how the journey to salvage Nigerians from the abuse of tramadol and codeine started.
Drug abuse has been a concern for me since I began my job as NAFDAC DG. I remember very well my first 2 quarters in 2018, I was virtually running after tramadol. Because at that time, Nigeria was being rained upon with tramadol coming from India. And I was amazed. Within that first quarter also, there was the issue of codeine abuse. I remember the BBC documentary on codeine abuse, how our young children were growing mad, how women were trading with codeine. It was a shock for me. So I was faced with 2 problems that I never envisaged: abuse of codeine and abuse of tramadol. For the codeine, we did a lot. Of course, the then Minister of Health banned the use of codeine, and NAFDAC sent a recall letter to all codeine syrup manufacturers in Nigeria. We were able to recover about 5 million bottles of codeine, which were put on hold at the different manufacturers' warehouses. It took a while for us to get over this because we asked the government to refund the manufacturers. Only 2 or 3 manufacturers were actually featured on that in that documentary. But finally, the government refunded the manufacturers that recalled their products, and which we have record of, and we eventually destroyed those millions of bottles of codeine in 2021.
As it was apparent that the stringent regulation on codeine was effective, the agency noticed that there was still a significant abuse of tramadol, which prompted vigilance.
In terms of tramadol, it was a shock to me that we had so much tramadol in 2018. But I believe what happened, from the information that I gathered, was that the Indian government was not as strict on exports of tramadol until September 2018, or maybe 3rd quarter of 2018. And the unscrupulous importers seized the opportunity before that deadline to start raining tramadol on Nigerians and for our children, women, men, young people to get hooked on tramadol. I remember that we got an intelligence report from the presidency that 31 containers of tramadol were coming our way in September. our port inspection, I gave directive to our port inspection directorate immediately, and they went on vigil. They apprehended about 21 containers of tramadol. NAFDAC has a tracking system to know where the shipments are on the sea. As soon as the unscrupulous importers knew that our port was hot, that NAFDAC was present at the port, 4 of the containers were transloaded in Malaysia. 5 turned back and went to the Republic of Benin. And immediately we got in touch with our ambassador then, that was there, Ambassador Oguntuashe. And it was a long battle. It was a long battle. At a point, the case was taken to court in Benin Republic. Finally, the government of Benin Republic said that they should be destroyed in Cotonou. And we were fortunate to get those destroyed on December 21, 2022. That was 4.5 years of waiting, of working to ensure that tramadol, those containers of tramadol never see the shores of Nigeria, in order to protect the health of our people, the sanity of our people.
The war against drug abuse will not be limited to prosecution, as NAFDAC will also create public programs on the adverse effect of aiding and abetting the illicit act.
We have done a lot in terms of drug abuse. We have gone into the community before the pandemic, into high school, secondary schools, using young pharmacists in the YADA program, Youth Against Drug Abuse. We have done sensitization in different parts of the country. We launched it in Kano. That was 2018, I believe, December. We keep going after the unscrupulous importers of tramadol or any narcotics. And now that NDLEA is also working very hard, NDLEA is also at the heels of people that are importing tramadol in strengths that are not approved. We only have 50, we only approve 50 and 100 milligram tramadol. So we've done a lot and we will keep doing a lot. We are also doing a lot of post-marketing surveillance, risk-based post-marketing surveillance, to ensure that those that we gave permit to stick to the approvals that we gave them. And if they do not, we can blacklist, we can deregister, we can hand out huge fines. So there are so many ways in which we are making sure that our population is protected against drug abuse. But we're going to do more. We're going to go more into secondary schools to educate our children, catch them young program. We're going to revitalize that. We're going to continue to use young people, university students, or young pharmacists, to make sure that they can speak to their own age group in the language that they understand. We plan also to do a lot of drama to project the evils in drug abuse. Go to churches to make sure, or mosques, to make sure that the word goes out that drug abuse can destroy lives.
There is also the challenge of drug hawkers who are patronized by unsuspecting Nigerians, both in the rural and urban areas of the country.
I've not been to many countries in Africa, but hawking of drugs is very common in our clime. Unfortunately, a lot of the drugs that are hawked from place to place are dangerous. A lot of them are broken down because of exposure to sun, A lot of them, especially liquids, have developed bacteria because of exposure to heat. And a lot of our people get ill, become ill, or even die because of drug hawking. It is a challenge to us as a regulatory agency because they are so fluid, their movement is so fluid. You arrest a drug hawker, take their wares, ask them to see us in the office, and before you know it, they've moved from quarter A in a particular town to area B in the same town. So it is very, very fluid, and it is almost a daily activity of NAFDAC to ensure that drug hawkers are sanctioned. But we also need to get the word out more that drug hawking can kill. Drug hawking can change quality of life, because even those that do the drug hawking doesn't know that drugs don't stay the same when you expose them to moisture, to heat, improper storage, and things like that. So we have to do more sensitization, which is part of this program. We also need a lot of staff. I mentioned post-marketing surveillance. Drug hawking comes under post-marketing surveillance. For those that we didn't approve, for those that we approved, we have to do post-marketing surveillance. And we need a lot of staff. We need a lot of tools. Getting vehicles. You cannot use Okada to start going from place to place in a city. So we need vehicles that we can easily use on, just at a go, to ensure that we move fast in order to make sure that drug hawking is mitigated.
Nevertheless, the agency is not relenting on its public enlightenment programs in a bid to alert Nigerians on the dangers of patronizing drug hawkers and unauthorized drug traders.
We're going to be using different means, using radio again. We'll be using radio, using these means, putting billboards up, putting billboards on buses where people can easily see. My advice to the public is, do not buy drugs that are hawked. Do not buy drugs that are hawked, because those drugs may kill. Those drugs may change the quality of life. Always go to a pharmacy setting, pharmacy store, not a corner drugstore somewhere. Go to a pharmacy setting where you can get receipt of the medicine you bought, so that if there's a problem, you can always say, I bought it from this pharmacy, that pharmacy. And most of the time, those that are bought from the pharmacy store will not give problems. So that would be my advice. For those who think that they can keep buying from drug hawkers, please save your lives. Do not buy from drug hawkers.
NAFDAC and your health will be back after this break. Stay tuned.
Beware. Fake or damaged drugs have put many people in serious health harms and have killed many others. But you can protect yourself by seeking professional healthcare advice when you feel unwell. Buy drugs from only licensed pharmaceutical outlets and make sure you check the packaging for poor condition, spelling errors, and unclear labelings. Also, check NAFDAC registration number, batch number, the expiry date, manufacture date, and manufacturer's address before paying, and always collect a receipt. If you suspect a drug to be fake or damaged, report immediately to NAFDAC on 0800-162-3322 or send an email to sf.alert@nafdac.gov.ng. Protect yourself and your loved ones. This message is brought to you by NAFDAC with support from WHO.
Welcome back. If you are just joining us, the program is NAFDAC and your health. NAFDAC is not taking lightly the essence of collaboration in the battle against drug abuse. The agency has worked with Lagos State Environmental Protection Agency (LASEPA) in time past to destroy over 2 million bottles of tramadol an exercise that demonstrates the capacity of the agency to work with partners outside and within the country.
Going on behind me is a preliminary exercise that we had to undertake here for the destruction of the codeine syrup that was seized by NAFDAC all over the country. If you do recall, codeine syrup constituted a menace to the society. A lot of people got addicted to it. The agency had to live up to its responsibility and respond appropriately by mopping up all codeine syrup in Nigeria. These syrups have been mopped up, kept in safe custody, and now we have concluded a perfected plan, and we have started the process of destruction of the codeine syrup. And that is what we are doing presently. It's a very laborious task, difficult task, because we have to open millions of bottles of codeine syrup, decant, and denature them, make them unfit for human consumption before we eventually destroy them. So what we are doing here presently is to ensure that the products that have been in our custody for a while are brought out, and with thorough supervision and diligence of our staff, especially the coppers we are using. We are going to decant over 2 million bottles of codeine syrup. Over 2 million bottles of codeine syrup, more from Nigeria. And we conduct this exercise swiftly, and we make sure that the syrups are properly disposed.
The destruction exercise happens in different phases. First, the denaturing phase. This process involves emptying the codeine syrup in different containers and then to different tanks, of which caustic soda will then be added to denature the syrup. These processes are carried out under strict supervision.
I think you're tearing it up. Bring it. Bring some.
Those ones are empty.
Oh, the empty ones, put them back here.
When you finish, you can't open 2 cartons at a time. No. Please, when you finish, you return the empty back. Then before you carry another carton. You understand?
The denatured codeine syrup is then evacuated to the Lagos State Environmental Protection Agency (LASEPA) for proper destruction.
We have about 2,700,000 bottles of syrup. We have to first of all denature it before handing over to LASEPA for final destruction exercise.
The destruction exercise at the Lagos State Environmental Protection Agency (LASEPA) had the DG, NAFDAC, Professor Mojisola Adeyeye, the Deputy Governor of Lagos State, represented by the Honorable Commissioner, Ministry of Environment and Water Resources, Mr. Tunji Bello, to oversee the process.
Very, very impressed about what Lagos State is doing. It's a state of excellence, so I don't expect anything less. We deliberated very well before we decided to use Lagos State. Consider the scientific factors. We wanted to make sure that the codeine syrup was deactivated before leaving our own site, so that it is no longer codeine syrup by the time it got here. And for Lagos State to put all this process in place, I believe we have a lot of hope for Nigeria. Thank you very much. Thank you. Thank you.
The General Manager, Lagos State Environmental Protection Agency, Dr. Dolapo Fashawe, gives an insight on the collaboration.
My joy today is that an organization like NAFDAC can come to LASEPA and have a collaboration on destroying expired chemicals. You may ask, what's the big deal? These things, if we pour them, as my commissioner has told me, into secondary drainages, it goes into our big water bodies, and they are chemicals and they are dangerous. Before now, what people used to do is just pour anything with water, or burn, or pour it in the water, codeine, then the fishes start to die. The ecosystem is disrupted.
About 3.5 years ago, that Nigeria suddenly found herself faced with scourge of abuse of codeine containing syrup by some of our youths. This abuse was as a result of consumption of codeine containing syrup against off-the-label use of the medicine. The effects of this abuse became alarming as presented in the BBC documentary in April 2018. The federal government, through the directives of the Honorable Minister of Health, banned the codeine syrup from the supply chain, from manufacturers' warehouses, distributors, pharmacy outlets, and so on. NAFDAC, as a responsible agency of the government, called immediately for recall of the syrup, and the exercise resulted in mopping up over 2.5 million bottles of codeine containing syrup from all over Nigeria by the agency's Pharmacovigilance and Post-Marketing Surveillance Directorate. These bottles were kept on hold at the respective pharmaceutical companies. After some settlements with the Pharmaceutical Manufacturing Group of Manufacturers Association of Nigeria, PMG-MAN, the codeine containing syrup were moved, the bottles were moved to the Investigation and Enforcement Directorate warehouse at Oshodi, Lagos. That is the agency's directorate in Oshodi. The next big task is taking a decision on how best to destroy 2.5 million bottles of codeine syrup. 3 directors of NAFDAC were put on this assignment. After a lot of deliberations by the agency's management, NAFDAC rationally decided that La Cepa waste disposal facility will be used to destroy the product. We arrived at this decision because we wanted the product to be safely destroyed without constituting hazard to the environment. Also, we chose La Cepa because it has technical competence and capacity to undertake the destruction. More importantly, the entire process will be transparent, as we are witnessing now, and we are aware that La Cepa will issue certificates of safe destruction at the end of the exercise. After a series of meetings between the 2 agencies and scientific considerations, the procedures for safe and efficient destruction of the product were arrived at and agreed upon. This included, first, the activation of the collected syrup at our own facility in Oshodi using caustic soda before transporting to La Cepa. The agency worked out the logistics of transporting over 260,000 liters of the syrup to La Cepa facilities in batches to cope with the capacity of the La Cepa plant. Today, I'm delighted that we chose wisely by asking La Cepa to undertake the destruction exercise. As the exercise progressed very well as planned, the exercise actually progressed very well as planned. I congratulate Lagos State Government for setting up this modern plant for safe treatment of liquid waste in Lagos. I wish to express my profound appreciation to the Deputy Governor for taking time to witness this exercise. I also thank Lagos government for making the facility available for NAFDAC for use, especially for this critical national assignment.
That's how we wrap up this week's edition of the program. Make it a date with us, same time, same station, next week for another edition of the program. Meanwhile, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food products peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, please call 0800 162 3322 or email nafdac@nafdac.gov.ng. Be part of the fight to safeguard the health of our nation. Stay safe always. See you next week.